Good afternoon, everyone. This is Greg Core from the Office of Special Education Programs, and welcome to our August Technical Assistance Call. During today's call, representatives from the Early Hearing Detection and Intervention Program from the Centers for Disease Control and the Health Resources and Service Administration, otherwise known as HRSA, will present their programs and how they will increase collaboration between state early intervention and EDHI programs. Presenters will also review the recently released letter on early hearing detection and intervention and Part C programs that was jointly developed by offices within HHS and education. That came out on August 5th, and I hope you've had a chance to read it. But in any event, we will be highlighting that today. So in addition to our representatives from HRSA and CDC, we will have representatives from the Arizona Early Intervention Program who will be presenting on their successful collaboration with their state EDHI program. Hosting today's call are our two very able OSEP state leads, Brenda Wilkins and Vanetta Freeman. I'm going to turn the call over to Vanetta.
Thank you, Greg. And thank you, everyone, for joining us today. As Greg mentioned, we will be discussing the collaboration between Part C, Early Intervention, and the EDHI program, also known as the Hearing Detection and Early Intervention Program. During today's call, please feel free to add your questions in the Q&A feature, and we will do our best to respond as time permits. During our time together, we will be reviewing how integrated interagency collaboration is critical to the Part C program comprehensive child find system. Brenda will be discussing the letter that was recently released, as Greg mentioned, and we also will be hearing from our three guests. Sandra Baptiste and Erica Odom is with the Department of Health and Human Resources and will provide an overview of their respective programs. The third presenter is Annie Carver, and as Greg mentioned, she's with Arizona's Early Intervention Program. And Annie will share about the collaborative efforts between the Arizona Part C Early Intervention Program and their EDHI coordinator in Arizona. Next slide, please. As we all know, Part C of IDEA aims to promote the development of infants and toddlers and enhance their capacity and their families, minimize infants and toddlers' potential for developmental delay, and improve long-term outcomes for children. Part C regulations require that each state develop a statewide, comprehensive, coordinated, that each state has a comprehensive, coordinated, multidisciplinary system to ensure that infants and toddlers with disabilities that are potentially eligible for Part C services are identified, located, and evaluated. As the regulations indicate, each state must have a referral system that is able to ensure that referral sources understand their child find requirements, understand their time frames for referral, have primary referral sources, and also be able to ensure that timely referrals are made. When we think about primary referral sources for early intervention, we typically think about physicians and parents. However, as states design their statewide comprehensive systems, it's important that we think about the critical programs within your states that are critical to making referrals for your early intervention programs. Next slide, please. As you know, identifying infants and toddlers who may require early intervention is a shared responsibility of all programs in the early childhood system. Collaboration and coordination between these programs is critical to ensuring that children and families have access to the supports and services that are needed to assist children in achieving their individual potential. IDEA Part C does list primary referral sources. However, it was never intended to be exhaustive. Thus, it's important that states fulfill their child find obligations and consider the programs in your state and local communities that work with infants, toddlers, and their families, and ensure that they understand the procedures for referring as soon as children that they know may be suspected of a disability as soon as possible. Now I'm going to turn it over to Brenda.
Thank you, Vanetta, and good afternoon, everyone. I'm excited to highlight the Dear Colleague letter between the EDHI and Part C programs. This joint, thank you for switching the slides. This joint letter from the U.S. Department of Education and Health and Human Services was released on August 5th, 2024, and highlights the importance of working together. The letter is a direct result of hearings from states and expressing the need for increased collaboration and support from the federal level. The letter highlights the requirements and expectations in federal law that support collaboration between EDHI and Part C programs. It also emphasizes the importance of data sharing to support ongoing collaboration between EDHI and Part C programs to coordinate child find efforts, activities, refer children from EDHI to Part C programs, supporting timely service delivery, and monitoring children's outcomes. And lastly, it provides technical assistance resources to support states in this collaborative work. We are committed to working together at the federal level and providing support for you as you implement coordination across all programs. And lastly, we truly recognize that we serve the same families and we want the best outcomes for all. Next slide, please. Now, I just want to talk about why it is important for the EDHI and Part C collaboration. One is holistic services. Holistic services are important. In order to address the negative impacts of the pandemic and long-standing challenges facing young children with disabilities, states and local communities must continue to build, enhance, expand their early childhood systems and programs. Next, equity for all. We want to increase access to families that have been historically underserved in Part C and EDHI. This includes, but it's not limited to, children of color, children living in poverty, and those who live in rural communities. Next is early identification. Early identification is key. We want to strive to identify children with delays and disabilities as early as possible. And of course, there's service coordination. Service coordination promotes, better coordination. Focusing on family-centered approaches helps empower our families. And of course, smooth transitions will lead to improved services and minimize disruptions to services as well. Next, and most important, data. Data sharing of data between both programs will enhance the effectiveness of our programs and assist in streamlined referrals in and outside both of our programs. So thank you. Please use the link, take a look at the joint letter. And next, I am going to pivot over to my colleague, Sandra Baptiste from HRSA. Sandra?
Thank you, Brenda. Good afternoon, everyone. I am Sandra Baptiste. I am a part of the HRSA EDHI program. I'm joined today by my colleagues, and we are excited to have this opportunity to share with you, at least from our side, what EDHI looks like. I'm hoping by the end of this, you will be inspired and you will have some tangible things that you could employ in your state systems to really collaborate with your EDHI program. Next slide, please. So our agenda is very short because I don't have that much time, but I'm going to go over the EDHI system really briefly, as well as the program requirements for our state and territory grantees. And lastly, look at some cross-collaboration opportunities for you and your respective EDI programs. Next slide, please. So when you look at this slide, you are seeing an illustration of what we have now called the EDI pipeline. And I believe that many of you know that EDI is responsible for newborn hearing screening, but the ultimate goal of EDI is to improve language outcomes. The ability to use language, and this is ASL or spoken language, predicts reading, communication, and many other outcomes that are important. State and territory EDI programs are encouraged to start on the left side of this diagram to ensure that every child is screened and gets a diagnosis. Other key steps that are critical in a family's journey include support, connecting to medical care, and ensuring appropriate early intervention services that emphasize a language-rich environment. Screening and initial connection to services is just the start of a family's journey. It's important that we don't see EDI as a series of steps: screening by 1 month, diagnosis by 3 months, enrollment into early intervention by 6 months. It's important to acknowledge that EDI is a system, and Part C is a part of the EDI system. Next slide, please. The vision and purpose of this program is to enhance the state and territory EDI system infrastructure to improve language acquisition for deaf and/or hard of hearing children up to age 3. If you look at the diagram on this slide, you'll notice that language acquisition is impacted by several components: timely screening, timely diagnosis, early intervention, and family support. Next slide, please. Now, we can't talk about EDI without talking about the legislation. So when we look at the EDI Act of 2022, you'll notice that the Act calls out 3 agencies from the United States Department of Health and Human Services. HRSA is one of them, and it carves out the responsibilities of each agency. Well, HRSA's responsibility is to develop and monitor the efficacy of statewide programs and systems for hearing screening of newborns, infants, and young children, prompt evaluation and diagnosis of children referred from screening programs, and then appropriate educational, audiological, medical, and communication or language acquisition interventions, including family support for children identified as deaf or hard of hearing. What's important to know is this highlighted part. It also must be consistent with programs that are mandated by Part C. So while the legislation carves out specific duties for HRSA, it also aligns our efforts with Part C. Part C is a part of the EDI program, EDI system. Next slide, please. If we were to look at it through some of the child fine regulations that Vanetta just spoke about, you'll see that really EDI is also a part of your system. In fact, our systems are components of a much larger system that serves families. This is really why we would like to encourage EDI programs to collaborate with Part C and Section 619 programs. We want to encourage you guys to work together because families only know one system. We want to make sure that navigating this system is accessible for all families. Next slide, please. So who are the key federal partners in the EDI system? You got it right. It is the three agencies under the United States Department of Health and Human Services, but it's also our colleagues at the United States Department of Education. We are all key players in the federal level that support EDI, and EDI touches more than just the Department of Health and Human Services for our programs to be successful. It does require working with other programs at the federal level, as we have been able to do with the Part C program. Next slide, please. So this is a very quick illustration of what EDI looks like on the HRSA side. Our portfolio, or our EDI investments, are pretty vast. We have state and territory grants that we provide to 59 states and territories. The focus is the EDI system and the infrastructure. We have 12 supplements for pediatric audiology trainees that we support. And then we have 3 TA centers. We have the Implementation and Change Center, Their job is to provide technical assistance and training to the state so that they achieve their goals and objectives. We have the Family Leadership and Language and Learning Center, or the FL3 Center, whose job is to support the capacity for family support and engagement, as well as family leadership. And then the Provider Education Center. This cooperative agreement supports or it increases the confidence and provides training to healthcare providers and allied health professionals that work in the EDHI system. While each TA center has its distinct focus area, the three of them do function as the EDHI National Network. And they are supporting not just our state and territory grantees, but stakeholders through technical assistance and training, policy analysis and assessment, partnership building, communication and dissemination, and evaluation. Next slide, please. So this slide is also not very exhaustive. This was the quickest way I could tell you about the project that we have. We just recently entered a new 5-year project period. It started April 1st of 2024, and there are 3 major components. There are key activities that our grantees must do for the duration of the 5 years. And then there are 2 phases. Phase 1, which is the planning year focused on assessing the current EDHI infrastructure. If you were to think about the EDHI pipeline, this is when they assess where the leaks are. And then we have phase 2, which focuses on implementation and building sustainable practices and their solutions and their activities to address the leaks that they found. In phase 1 of the project, I just wanted to highlight that we encourage the grantees to establish and maintain partnerships. And this includes key partnerships with programs like Part C and Head Start. And then in phase 2, they are expected to strengthen the relationships with their state and territory early intervention providers. Next slide, please. So what does collaboration look like between Part C and EDHI? I am glad you asked. This list is not exhaustive, but these are some of the popular ways we have seen it show up and work across both programs. We have planning groups and councils. So serving on advisory councils or state interagency coordinating councils, engaging in strategic planning work groups. These sorts of things are great ways to start the collaborative process and the discussion among both programs. Coordinating program referral systems and information exchange to ensure children are identified and enrolled in services early is another way. When we think about data sharing, tracking, and surveillance, I know this is a big one, but coordinated data systems help states identify and address the gaps in services or the leaks in the pipeline. This includes evaluating and improving IDEA child find, training and technical assistance, the direct training technical assistance between state and local programs to support professional development, educational opportunities, or taking advantage of the TA and the training offered by HRSA and OSEP TA centers, kind of like what we're doing today. And then lastly, family support and engagement. This is something that, at least on the HRSA side, we cannot stress this enough. Both EDHI and Part C benefit from family support and engagement, often serving the same families in different ways or shared connections. Collaborative activities with family leaders and mentors will also help encourage families to enroll in early intervention services. Next slide, please. I know we've talked about this briefly, but moving forward, recently HRSA, OSEP, and CDC released a joint letter highlighting the importance of working together. This letter is a direct result of us hearing from our EDHI grantees the need for collaboration and support at the federal level. We are committed to working together at the federal level and providing support for you as you implement your programs, coordinate across your programs. And lastly, again, we recognize that we serve the same families and we want the best outcomes for all families. If you have questions, you can definitely put it in the chat. I do believe the next slides are just contact information, my contact information, as well as HRSA's information, social media, in case you wanted to connect. So questions, please put them in the chat. Thank you so much for this wonderful opportunity. I will turn it over to my CDC colleague, Erica Odom.
Thank you, Sandra. Next slide. All right, so my name is Erica Odom. I'm with the Centers for Disease Control and Prevention. And again, I will be focusing my section on data. CDC is heavily focused in the data area. So next slide, please. So the CDC EDHI program supports states and territories in collecting and reporting data to monitor progress for newborn hearing screening, evaluation, and early intervention by 1, 3, and 6 months of age, respectively. Our mission, we do this mission by conducting continuous evaluations. We use data to improve data quality, timeliness, and to address disparities in our data. And we assess EDHI's impact on developmental outcomes for infants identified as deaf or hard of hearing. So you'll hear me say data a lot because CDC's mission is focused on that data collection and reporting. Next slide, please. In 2022, CDC and HRSA federal program teams came together to develop a joint logic model. And this logic model identifies that both HRSA and CDC fund programs to improve outcomes for deaf or hard of hearing children and their families. HRSA's investments focus on supporting comprehensive and coordinated systems of care. And Sandra just did a beautiful job of going through what those systems of care sort of focus on for families and children. CDC's investments prioritize data collection, data reporting, and improving data-related processes. HRSA and CDC coordinate their activities with stakeholders towards the common goal of the legislation that Sandra pointed out that guides each of our work. HRSA and CDC intend for short-term and midterm outcomes to be achieved by 2029 in this logic model. And the long-term outcomes and their impact speak to our overall vision of EDHI programs and will likely take longer to achieve. But that impact will focus on all deaf or hard of hearing children reaching their age-appropriate language milestones and other developmental outcomes. Next slide, please. So what do we get out of our data? This slide shows our most current numbers that show our national progress towards meeting EDHI 136 goals. In 2021, about 96% of infants met the 1-month benchmark of having their hearing screened. 42.7% met the 3-month benchmark of receiving a diagnostic evaluation, and 42.2% met the 6-month benchmark of enrollment in early intervention. So we're doing really well at screening and have some room for improvement at diagnostic evaluation and enrollment in early intervention for children identified as deaf or hard of hearing. Next slide, please. Our current funding, we have 2 funding lines, and the first one is our EDHI jurisdictional funding. It's about, we fund 39 jurisdictions that include states and territories to submit data. We have 2 data submissions. One is individual child level data we refer to as iEDHI, and one is aggregate data or survey level data called the Hearing Screening and Follow-Up Survey. Each of those 39 states or territories are awarded about $160,000 a year to do this data collection. And expected outcomes include use of timely, complete patient-level data for tracking and decision-making in their programs, and increasing the number of infants diagnosed and the increasing enrollment in early intervention. So if you refer back to those 136 national numbers, we want those 3 and that benchmark at 3 and 6 months to be improved. Next slide, please. So again, this is just a map of our currently funded jurisdictions. Next slide, please. And these are a list of the data elements in that individual level data collection. And we encourage states to use these data to improve their programs and ensure that all infants born deaf or hard of hearing receive those timely follow-up services at 3 and 6 months. In our data dictionary, there are about 179 data elements. Not all of these elements are required. We recognize that states may have some limitations in getting access to certain data elements. And in this slide, we have listed those required and optional categories of data elements for our jurisdictions. Next slide, please. Our second funding opportunity is the cooperative agreement we call ODESE, and that's spelled ODDACE, which stands for Outcomes and Developmental Assistance Center for EDHI programs. The goal of this project was to establish and support an outcome center to coordinate and assist participating states and their partners on how to gather, analyze, and use early intervention developmental outcomes data. The University of Colorado was awarded this project over a 3-year period, and we are now in the final supplemental year. Expected outcomes included collecting standardized surveillance data on outcomes of children who are deaf or hard of hearing. And the outcomes we focused on were language outcomes, and then to increase the understanding of factors impacting those language outcomes of children who are deaf or hard of hearing. Next slide, please. So we currently have manuscripts in progress related to this work. One of our studies looks at bilateral and unilateral hearing differences for children. We are also looking at an examination of language outcomes relative to age of diagnosis and enrollment in early intervention. And another manuscript looks at the relationship between early childhood measures of language and related skills in children who are deaf or hard of hearing. So we use this data to understand development of children who have a deaf or hard of hearing diagnosis and understand what we can learn about having children enrolled in 136 in a timely manner and how that's linked to their language outcomes. Next slide, please. Again, everybody has shared this joint letter, and I'm going to focus on the data-specific portion of this letter in terms of data collection and data sharing. So in the letter, it states coordinated care depends on the ability to share data between EDHI and IDEA Part C programs within states. In addition, data sharing allows programs to make data-informed, evidence-based decisions that promote effective policy and practices and provide accurate and timely services to deaf or hard of hearing children and their families. So again, data undergirds all of our decision-making. And so data sharing between EDHI programs and IDEA Part C programs is very important. Data sharing between these programs is permissible when done in accordance with applicable laws, including, of course, FERPA and HIPAA. And data sharing agreements must be in place for data sharing to occur. Next slide, please. So CDC has a NOFO that has been forecast. Next slide, please. And included in this funding opportunity as a result of our lessons learned across the jurisdictional NOFO that's currently in place and the ODESE program, we have developed this opportunity forecast. That's listed at grants.gov, and you can see the link below. The forecast provides an idea of the focus areas for future funding if congressional funds become available in fiscal year 25. The focus areas include improving data completeness, validity, and data linkage, as well as data integration, facilitating data analysis and use of data to address disparities, and incorporating communication outcomes into EDHI surveillance. Next slide, please. Last but not least, if you scan the QR code, you can access the current 2021 EDHI annual data. And I have listed my contact information and the CDC EDHI program's email address for further inquiries. Thank you so much.
Good afternoon, everyone. I want to thank you for allowing us to share our state example. And Tracy, if you don't mind going to the next slide, that would be great. So today I'm going to talk about our EDHI partnership. I have with me our state's newborn screening manager, who's also our EDHI coordinator, Fran Altmeyer from the Arizona Department of Health Services. We wanted to share our example with you from Arizona. Following the most recent HRSA grant award, our Department of Health Services created an EDHI advisory committee that is led by the Arizona Commission for the Deaf and Hard of Hearing. And so our Arizona Part C program under the Department of Economic Security will be participating in that as an advisory council. So if you go to the next slide, please. So Arizona's Part C lead agency and our state EDHI's program are located in two different state agencies. While our state is unique in that our lead agency is within the Department of Economic Security, our state's Department of Health Services houses the Office of Newborn Screening, which manages over 30 newborn screening conditions, and it also includes the EDHI program for our state. Since we're two separate agencies, it means that we are also physically in separate buildings, literally separated by our state's Capitol building. However, we were able to build a road to connection by leveraging relationships and our strengths. And I don't know, Tracy, if you're able to click, I got a little animation there to show the road. I don't know if it'll move forward or... Yeah, perfect. Thank you. While we're physically separated, our buildings are in fairly close physical proximity, which allowed us to walk a couple of buildings down to meet each other in person whenever we needed. Although Arizona is a larger state, I like to say that we're a close-knit community, and we like to recycle staff and often see team members within our Part C early intervention programs promote or take on new roles within early childhood around our state. One of these was that our newborn screening manager promoted from a supervisor in one of our service providing agencies into her current role at the Department of Health Services as the newborn screening manager. So while she was no longer in Part C, she wasn't very far from us, both physically and emotionally. So she has a solid knowledge of both programs and a friendly mentor type relationship with our Part C lead agency colleagues, and used it to help work through concerns and overcome challenges with linking our Part C data with our EDHI data. Understanding both HIPAA and FERPA was essential to starting that bridge to divide the distance between the programs. When it came down to it, she had the patience and persistence in working through all of the concerns. The challenges were easy to work through once that relationship was established and the concerns were actually acknowledged. And if you'll go to the next slide, please. So not only are we in two separate buildings, but we also had to work through how to link information in two different data systems, storing information about some of the same children in two different places. Our Part C primary database is a homegrown SQL application, and our EDHI program uses HiTrack, which they've licensed for Arizona. HiTrack is one of several databases that's used by other states, including Idaho, Hawaii, Illinois, the Marshall Islands, Montana, Ohio, and Utah. So one of the minor challenges that we had were having two different record retention schedules. Some of the largest issues we had were understanding how to address confidentiality issues, since both data were protected under different laws across both agencies, including Family Educational Rights and Privacy Act, FERPA, and HIPAA. So once we had worked through our concerns and had all our questions answered about privacy, we were ready to link. So if you could click one more time for me, Tracy, please. Thank you. We had to decide on technology. So forgive me for just a minute. I'm going to get highly technical because I know there might be some people that really want that to know the nuts and bolts of what we did, but then I'll come back to speaking idea part C and our alphabet soup of acronyms. So at that point in time, we considered an application programming interface, API, but ultimately decided on a flat file data exchange using a secure file transfer protocol, also called an SFTP. This was part of my learning experience as a new data manager. I didn't know any of those words. I came from the field as a service coordinator, so all this technical language was beyond my knowledge at the time. However, the technical details are all common knowledge with developers and business analysts, so they held my hand and explained it over and over again until I started getting an understanding. We have a process now that automatically checks the name, date of birth, and gender. If it's a match, it enters all the information into our database automatically, or automagically, as I like to say. When we get a partial match or no match, then that's when we go in and manually link the data. We'll search for that child under different versions of the name and date of birth. Once the data is linked, every week there are updates that are sent on major milestones, such as when a child has been referred to early intervention, when that child's eligibility has been determined, when they've had their individualized family service plan, and it allows both programs to pull reports separately, or we can use aggregated reports to look at our data together. Part C has our own unique ID number, which is now captured in the HITRAC system through our Arizona Department of Health Services as a secondary key. And the HITRAC number that our Arizona Department of Health Services use is a secondary key and captured in our IDEA Part C database. So this allows us to cross-link child level data in both databases. We wanted to go beyond just linking and really be able to understand critical questions about the children in both programs. So our newborn screening manager worked with their HITRAC vendor to request updates to not only make data linking possible, but to also collect information on our global child outcomes. So those global child outcomes related to the SPP APR indicator C3. So we now report the OSEP progress categories once a child is exited to our EDHI program, which is really exciting. Next slide, please. In 2017, our newborn screening manager applied for and was awarded a grant for our state's EDHI program through a cooperative agreement with the CDC. This funding supported the program's IT to assist in developing the plan for data exchange needed, and it helped with identifying needs for a data sharing agreement. It led to a formal interagency service agreement with deliverables from our program in Part C, including creating the data sharing agreement and utilizing technology to link the data using that secure file transfer protocol that I had mentioned. As a bonus, a joint conference was also held to provide professional development to our providers to really help them understand the EDHI program and the supports available for children who are deaf and hard of hearing around our state. While the extra funding for this project was nice, the technical assistance we received from the Daisy Center was by far the most valuable aspect of the project. We participated in regular phone calls with the Daisy Center staff who helped support with understanding the nuances of FERPA, of the FERPA protections, including exceptions to FERPA, specifically the audit and evaluation exception, which has made this possible. Their staff supported us with looking at the critical questions about early intervention services so we could see how we could look at more than just compliance with the state law or federal laws and guidance around EDHI. And it really helped us improve our reporting. So we can get more important information like what are the child outcomes for children who are deaf and hard of hearing in our state compared to the same population who have not been identified as deaf or hard of hearing. The regular check-ins helped provide accountability on working towards data linking and a place to share successes. So I really appreciate that. And if you'll go to the next slide. As a new data manager, I understood the need to protect the data in our program, but I was less familiar with what conditions the Family Educational Rights and Privacy Act permits the disclosure of personally identifiable information from education records to third parties. So generally, and that's the key word here, is generally FERPA requires written consent from parents in order to release that personally identifiable information. But in the absence of written consent, FERPA does permit an educational agency like our Part C program to disclose those personally identifiable information from an education record of a child if the disclosure meets certain conditions. So that first QR code on the slide is a summary of those FERPA exceptions from the Privacy Technical Assistance Center with a high-level overview of the 4 most commonly used exceptions to FERPA. And the applicable record keeping requirements. For a more detailed explanation of the audit and evaluation exception and some of the other FERPA exceptions, I really highly recommend this. So the DAISY Center helped us understand how to use that FERPA audit and evaluation exception. And I keep repeating that because if you don't already use that, I do think that's a really critical piece of information that formed the most significant basis of our data sharing agreement. And if you need help or support understanding it, I definitely recommend contacting your assigned technical assistance centers for support. The DAISY Center also showed us where to find the Privacy Technical Assistance Center written agreement checklist, which is that second QR code here at the bottom. And they made sure that we documented the audit and evaluation exception appropriately, including designating someone to receive the information that was protected by FERPA. The minor issue I noted about records retention earlier was sorted out by writing it all down in our written agreement. Our agreement includes a list of every single field we can share, so it's crystal clear what we are sharing and why. I've had to refer back to it a few times before sharing information just to make sure that I didn't disclose something I wasn't supposed to. It also helps because if I were to leave, the next data manager will know exactly what can and cannot be shared. So we still want to be sure that we had everything right. We trusted our guidance, but we really wanted somebody to look at our written agreement. So the DAISY Center also facilitated a review by the Privacy Technical Assistance Center to look at the data sharing agreement to add one last round of feedback to make sure we documented everything adequately. So if you'll go to the next slide, please. So here's a look at how we've done over time. We're using the data to gather information to evaluate our child find activities, to identify the gaps with audiologists where we need to do education on making referrals to Part C. We're using it to evaluate those 136 EDHI goals to ensure that children are being enrolled in early intervention by 6 months. We're auditing our processes to ensure that the EDHI program is reporting all our shared children and that we weren't losing them in the database due to technical issues, and making sure that they weren't being missed from early intervention entirely. So we began linking data in 2019, and the number of children who are deaf and hard of hearing have gone up pretty steadily since then, with a little bit of a hiccup lately. However, that's given us information so that the newborn screening manager and I can audit our process and identify ways that we can improve. Our mutual respect in realizing we have the same goals to get children enrolled in Part C as early as possible has paved the road to work through the challenges together and to get to where we are now. So what's next for Arizona? We're working on improving our automated matching system. We want to add the child outcomes and the family outcomes to this dashboard up here, so we can really evaluate the impact of early intervention services on our infants and toddlers and their families. In addition to the data exchange and data sharing agreements, these data sharing agreements laid the foundation and the groundwork for capturing language acquisition outcomes for our children 0 to 3 to really ensure that those 136 goals is having a lifelong impact on children receiving early intervention services. And if you'll go to the next slide, please. So thank you for letting us share our state example. I hope this has helped inspire you. The QR code here will let you save my contact information as a V-card, so you don't have to type it by hand. If you'd like more information on our work with the Arizona EDHI, the Arizona EDHI program, or you want to see a copy of our data sharing agreement, please contact me. If you're an introvert, feel free to email me or send me a message. I will be at the upcoming IDIO conference as a Part C data manager at the end of the month. So if you're an extrovert and you want to chat in person, come find me and say hello. So thank you very much to our OSEP colleagues, HRSA colleagues, and CDC EDHI colleagues for letting me present today. And Fran and I are both here if you have questions on either side of the Part C or EDHI program.
And Greg, we're going to turn it back over to you to close us out and give any other announcements for the field today. But we do thank you all for listening to the content that we shared today regarding the importance of Part C and EDHI collaborations. The slides will be posted with our presenters' contact information. Please continue to put questions in the chat, but I will turn it over to Greg to give additional OSEP updates and announcements.
Thank you, Vanetta. And I want to thank our presenters for a terrific presentation today. Sandra from HRSA, Erica from CDC, and then Annie. We really loved hearing your state example from Arizona. I think it was truly inspiring, and I hope other folks listening in found it the same way. I do have one announcement to make at the end of this call, just to let everybody know that next week, OSEP will be hosting its Smart Beginnings virtual mini conference. This is the third consecutive year that we've done this. I hope you've been getting emails about it. If you're on our listserv, you probably have. But just to refresh your memory, Smart Beginnings is a virtual conference designed to help families, providers, and leaders better support and promote developmental outcomes and educational excellence for infants, toddlers, children, and youth with disabilities and their families. K-12 educators, early childhood personnel, related service providers, administrators, and families are invited to learn more about improving academic and developmental outcomes. We have this broken up into 3 days, next Tuesday, Wednesday, and Thursday from 2 until 3:30 Eastern Time. On Tuesday, the 27th, the focus will be on educators and administrators. Then on Wednesday, the 28th, will be focused on families and parents. And then finally, on Thursday, the 29th, it will be on early childhood personnel. So please try to tune into this. I think you'll find it valuable. Registration is required. So if you don't have the email, you can just Google Smart Beginnings OSEP 2024, and that will bring you to the registration information. So with that, I want to thank all of you out there who have been listening, and thank our presenters again, and special thanks to Vanetta and Brenda for hosting today.